important for persons to be able to ask the questions and be able to debunk some of the myths and the untruths that are out there about the COVID-19 vaccine. And so we are happy that we were able to be here at the Branch Welch Primary School in Boyd. Next Wednesday, we're going to be in two communities actually. We're going to be in the St. Johnson Community Center, but we're also going to have another team that's going to be at the McKnight Community Center doing the same thing, sharing the information and giving persons as much feedback as we can about the AstraZeneca COVID-19, because it's important for us to make sure that we reach that 70% herd immunity necessary for us to be able to get our lives back to as normal as possible. Encouraging everyone to roll out. Don't wait, vaccinate.
Just witnessed the handing over of a generous donation of 20,000 doses of the AstraZeneca Oxford vaccine.
It was a kind one, as India understands that it is important for us to be able to ensure that the entire world of COVID-19, and the only way we can do that is through vaccination.
We come these additional doses because it would help us to provide a greater percentage of our population in terms of vaccination against this virus.
And just to note that St. Kitts and Nevis is also paying forward, and we are going to assist the government and people of Grenada by donating 2,000 of those to the people of Grenada. And so once again, we just want to thank the government of India, and remember, don't wait, vaccinate.
Tonight we had another successful town hall meeting in which we engaged the community regarding the vaccination rollout in St. Kitts and Nevis. This afternoon we had just under 6,000 persons who have been vaccinated. That brings us 18% of our target, which we need to have vaccinated to achieve herd immunity. Tonight's session was to bring the information to the people in a manner in which they have the opportunity to share their concerns, to express their fears, and to have them answered by the professional and the health. I want to commend our Medical Chief of Staff, Dr. Cameron Wilkinson, our Permanent Secretary in Health, Dr. Dolores Stapleton Harris, and of course the District Medical Doctor, Dr. Nisbet, for participating participate in this very rich experience for the people of the community halls and the adjoining areas. I think this has been highly successful. We had a sense we are at the end of the question and answer period, and a number of persons move forward to vaccination. That tells me that it was very persuasive, it was impactful, and it has helped. These persons are going to be ambassadors, going to be out with their own experience, sharing with others, and as a consequence, we're going to persons participating in the program.
I will take the vaccine because building defenses against COVID-19 is a team effort, and we are all a key part of that defense.
I will be taking the vaccine when it's my turn.
I will be taking the vaccine as it is an important tool in the pandemic.
It's important for me to vaccinate to ensure that if I do become infected with the disease, it can prevent hospitalization. In addition, it also helps with herd immunity.
I will take the vaccine to protect myself, my loved ones, clients, my co-workers.
St. Kitts and Nevis, why do we need to vaccinate? Kenisha? So we can put COVID-19 away.
It's me, E, and I'm here with one message. Roll up to roll out. We all know how difficult it is during this COVID-19 pandemic. While we continue to wash our hands,
is on.
A pleasant afternoon and welcome to the National Emergency Operations Center COVID-19 briefing for the 1st of June 2021. I want to thank you for joining us for this emergency briefing. As usual, we continue to bring you the latest updates with respect to what is happening here in the Federation of St. Kitts and Nevis in relation to the COVID-19 pandemic. Today also begins the hurricane season, and it lasts until November 30th, just to mention. Without further ado, I would invite the Medical Chief of Staff at the Joseph N. France General Hospital, Dr. Cameron Wilkinson, to address us.
Thank you, Leslie. I begin my presentation by stating, given the facts, our people will rise to address any national crisis. Given the facts, our people will do what's right for themselves and, more importantly, for all others, in keeping with our motto, country above self. So far, more than 60% of the nation's adults sent a strong message that they listened to the facts and believed in the science and went forward and got vaccinated. So far, more than 60% of our nation's adults have decided not to wait for an alternative vaccine and took action now, not just to protect themselves, but our children, our pregnant mothers and the unborn, and the elderly and frail. You understood that in a pandemic, time wasted could result in lives lost. So far, more than 60% of our adults have rolled up their sleeves and taken the first shot of the AstraZeneca vaccine, and about a quarter are now fully vaccinated. There were some who held back because of genuine concerns, and these were with our far-reaching education program on the vaccine. Many who were undecided came forward and are still coming forward, knowing that the vaccine gives them, 1, a 63 to 83% protection from catching COVID, even if the contact with someone with disease, 2, an 84% protection from getting a disease requiring hospitalization, and 100% protection from COVID-19. You would have gotten vaccinated not just to protect yourself, but others. We are in community spread like almost every other country across the face of the globe. It is no surprise, it was inevitable. The warnings went out repeatedly that we could not and will not remain COVID-free and that the virus will return. We warned that despite our most stringent entry protocols, that the virus would hitch a ride with someone and get into our community. We urge you not to get complacent, as this virus is relentless in its attack, and we individually and collectively needed to be relentless in the fight. We were fortunate to have held it at bay for so long, as it gave us the time to prepare and protect ourselves and the vulnerable among us. The majority have done what was needed to protect themselves, the children and the elderly and frail, so that we should not see an overwhelming of our healthcare system. It's not too late for you who are not vaccinated yet to protect yourself. Tomorrow is the last day you can go and be guaranteed a first and second shot to be fully vaccinated from this current batch of vaccine before another batch arrives. Even after, you can continue to come in and get your first shot, as this will give you a 76% before you get your second dose. We will continue to vaccinate until the last dose of this batch is used between now and June 30th. Remember, vaccines are a precious and scarce commodity globally, and none will go to waste. Getting vaccine is still a voluntary choice, but with choices come consequences. By not getting vaccine, you can jeopardize the health of those around you in your homes and schools and churches, business. More importantly, you may jeopardize your own life. Many persons from all walks of society are waking up to the stark reality. They received a call that their name was listed as a significant contact. I received a number of calls over the last few days from persons who were very distraught to hear that they were named as a significant contact and had been placed in quarantine. Some were placed in isolation because they tested positive. Many expressed regrets at not listening to the advice given to the health authorities, or regrets over being ill-advised. We will continue our contact tracing and continue to widen the web of testing to ensure that this deadly finds no safe haven to continue its spread in our community. We will do what we have to do, and as we extend the contact tracing, we would have to get more positive. Not stop until we have eradicated this virus from our community. I urge those who have not yet been vaccinated to go forward tomorrow and the days after to do so. I urge those who have received shot more than 4 weeks ago to make sure that they follow up with their second dose to be fully vaccinated. The vaccine is a shot at protecting ourselves. In Brazil, deaths are plummeting because of vaccination. In the United States, deaths are down 99% because of vaccination. In the United States, the economy is projected to rebound as they have been experiencing record decrease in number of cases and deaths from COVID as their vaccination program rolls out and sees success. If we were never united before as a nation, let us unite now with a clear, common, and simple message that getting vaccinated is our best defense against this virus. If this outbreak were to have occurred last June, we would have seen an overwhelming of our healthcare system and rising death toll from COVID-19. We are in a much better position to halt the spread of disease today because a significant proportion of our population is now vaccinated. One life lost from this deadly virus is one life too many. You can be a hero by saving a life today through your actions of getting vaccinated. Heroes are not made in a crisis. In a crisis, they are unveiled. I want to take this opportunity to thank all the heroes who were during this crisis, those in leadership, in the COVID-19 task force, the Health Emergency Operating Committee, frontline workers along the corridor of containment, including those in immigration, customs, transport, and frontline workers in the hotel and tourism industry, and also those in the media who have educated and informed the public. Most importantly, all of you who abided by the non-pharmaceutical measures that kept us safe until the vaccine arrived, and the over 60% persons who did what was right themselves, all others be vaccinated. There is still an opportunity for heroes to be unveiled, as there is a hero that lies in all of us. Go forward, vaccinated, if you have not done so. It is the only way we can free ourselves from COVID-19 and get back to thank you.
Thank you very much, Dr. Wilkinson. I invite our Chief Medical Officer, Dr. Hazel Laws, to present us with the Health Emergency Operations Center Situation Report.
Thank you, Mr. Williams, and a pleasant afternoon to everyone. This afternoon, I will share with you the Health Emergency Operating Committee's Situation Report for Tuesday, June the 1st. Ladies and gentlemen, within the last 24 hours, the Ministry of Health has received positive results for 4 additional confirmed of COVID-19. We have started contact tracing for the original 2. The results of the last 2 cases just came in within the last 5 minutes. These 4 additional cases will be referred to as cases number 70 through to number 73. So as at present, the Federation has reported 73 confirmed of COVID-19, 59 cases St. Kitts, 14 cases Nevis. Please note that 48 cases have fully recovered. At present, we are following and monitoring 25 active cases. The public health team has conducted in-depth interviews with cases number 70 and case number 71. Again, the public health team has conducted in-depth interviews with cases number 70 and 71. And we have not found a link between these 2 cases and any of the recently confirmed cases. And there isn't a recent travel history to or from a hotspot. So, ladies and gentlemen, based on the information we have, this is a state of community spread. A state of community spread implies that the virus is now circulating in the community, and so it's theoretically possible for someone within the community to contract or pick up COVID-19. Now, ladies and gentlemen, the virus needs the human body to move from one person to another. And so as individuals, we now have an individual and collective responsibility to break the chains of transmission of this virus. And we can do so by using the measures that we have been recommending for the last few months. And these measures include vaccination and adherence to the COVID-19 prevention and control measures. In particular, the wearing of the face mask, maintaining adequate hand sanitation, and physical distancing. Now, the Ministry of Health, our main task at present is to contain this wave of COVID-19 cases. Our aim is to flatten the curve and make sure that we have minimum number of persons being impacted or becoming or contracting this disease. And so we are employing the well-known public health measures, including contact tracing. The contacts are placed in quarantine. The cases are placed in isolation. We are testing all contacts, and we are also doing targeted testing. So there are a few communities whereby we will be just doing targeted testing with respect to individuals who may have been exposed to the virus. Contact tracing is a process whereby the public health team identifies, evaluates, and manages those persons who were exposed to the virus. And the aim is to prevent the onward transmission of the virus. And this works. Contact tracing is well known to break the chains of transmission. So the Ministry of Health, we have been engaged in this process since Wednesday, May 18th, and we will continue. All right, so we'll be continuing our testing of contacts and targeted testing. So now in this vein, I want to share some information. On the holiday weekend, we would have gone to the Sandy Point Primary School. We would have tested those students in grade 1 and grade 2, and the student households were placed in self-quarantine. So in other words, on the holiday weekend, the students, they received their first test, along with the teachers at the Sandy Point Primary School. Now, the end of their quarantine period is fast approaching, and so the Ministry of Health will be coming back or going back to the Sandy Point Primary School on Thursday, June the 3rd at 9 a.m. The students in grade 1 and grade 2, along with all the teachers. So once these tests return, if the tests return negative, then the students and the teachers will be officially released from quarantine. Same thing will be done at the Charles E. Mills Secondary School. Again, the team, we went there last holiday weekend. The students and teachers, they got their first test. Now, the second testing will take place this week, June 3rd at 2:30 p.m. And so we are asking the students to return to the school this coming Thursday at 2:30 p.m. For your second COVID-19 end of quarantine test. In terms of the Seventh-day Adventist Primary School, those students who were tested previously, that's last week, Wednesday, Thursday, we are asking you to return to the school this week, Wednesday, which is tomorrow afternoon at 4 p.m. So that's Wednesday, June the 2nd at 4 p.m. so that you can receive your end of quarantine COVID-19 test. So in other words, the self-quarantine period requires 2 tests. One at the beginning of the quarantine period, and then as the final test at the end of the quarantine period. Once your test result returns negative, then you will be free, you'll be officially discharged from quarantine. The public health team will be visiting the Washington Archibald High School on Friday morning this coming Friday, June the 4th at 7 a.m. Yes, as early as 7 a.m. such that the students who were tested, they will get their end of quarantine COVID-19 test at this time. The public health team will move right on to the Bastia High School on Friday at noon, lunchtime, in order for the students at the Bastia High School to be retested. And then on Saturday morning, June the 5th at 10 a.m., the public health team will be going back to the Tyrrell Williams Primary School in order for the students and the teachers who are implicated to receive their end of quarantine COVID-19 test. Now, the 311 operators, they are receiving a number of calls regarding the quarantine and isolation order. So the individuals who are in isolation, meaning the cases, and those who are in quarantine at a government or COVID-19 certified facility, and those individuals, those family members who are in self quarantine, they are requesting that official letter that certifies that they were placed in isolation or quarantine in order for them to submit same to their employers, and this letter can also be used for their Social Security claims. So we are asking you to submit your request through the headmaster of either of the 6 high schools. That is, if your child or your ward is placed in self-quarantine. However, if you are not in any way related to the school system, we are asking you to submit your request through the 311 operator, such that your letter be prepared so that you can submit same to your employer and it can be utilized for your Social Security claim. Again, the contact tracing exercise continues. All right, so we just announced 4 additional cases, and so the public health team will continue their robust contact tracing process in order to identify the contacts, test, and we will also conduct targeted testing in some of the implicated communities. Now, the AstraZeneca, Oxford, okay, yeah, there are three recent recoveries. Yeah, so we have a total of 3 recent recoveries. Now, the AstraZeneca Oxford vaccine, we continue to offer same. Again, this vaccine provides you significant protection against the SARS-CoV-2 or the COVID-19 virus. It reduces your risk of contracting same. It reduces your risk of transmitting the virus. Once you're fully vaccinated, you enjoy a reduced risk in becoming very ill from this virus, and the manufacturers assure us that it reduces your risk of dying from this virus. Now, we're getting a number of questions regarding the dosing interval. Now, when we started our camp or program, when we launched or implemented our COVID-19 vaccine program, originally we were given 10 weeks appointments between dose 1 and dose 2 of the vaccine. However, we all are aware that the shelf life of the vaccines is limited. They expire by the end of June this month. And so if you come in tomorrow for your vaccine, you will be given a 1-month appointment. So there will be a 1-month interval between your first dose and second dose. Please note that the manufacturers, has advised that the dosing interval can be 1 month and it can be as long as 12 weeks. So that's the window within which we are working. So now if we have individuals coming in to the health centers this week, Friday, for the AstraZeneca Oxford vaccine, you will then receive a 12-week appointment, and so your next shot will be given when we receive the next batch of vaccines. Again, our national COVID-19 vaccination program was launched on February the 22nd. Now, as at end of work day yesterday, the team administered a total of 27,173 COVID-19 vaccines, 20,654 in St. Kitts, 6,519 vaccine doses administered in Nevis. So, ladies and gentlemen, almost 60% of the target population in the Federation has been covered with the first dose of this vaccine. Almost 23% of the target population is fully vaccinated, covered with the 2 doses of the AstraZeneca Oxford vaccine. So let me repeat, almost 60% of the target population covered with the first dose, almost 23% of the target population fully vaccinated or received the second dose. I just want us to be reminded of the SRNOs number 14 and 15. Just to remind you, our schools remain closed until June the 8th in the initial instance. And then there is restriction on of public transport, whereby the buses and the ferry, the capacity is limited to 50% capacity. And there is also a restriction on contact sports. Let me elaborate. And I'll read and I'll quote from the SRNO. No person shall attend sports training or practice sessions for amateur or other recreational sporting events at this time. In reference to the 2 World Cup qualification matches, only approved officials and players can attend the 2 upcoming World Cup qualification matches scheduled for June the 4th and June the 8th. Let me repeat, only approved officials and players can attend the 2 World Cup qualification matches. These matches are scheduled for June the 4th and June the 8th. June the 4th, St. Kitts versus Guyana. June the 8th, Guyana versus Puerto Rico. So in other words, no spectators are allowed at these 2 upcoming World Cup qualification matches. SRNO 15, there's restriction of movement, curfew, daily curfew between 11 p.m. until 5 a.m., and a restriction on regional and international tourists who are expected to submit proof of full vaccination as of May the 29th. Citizens and residents are exempted. However, please note all inbound passengers must still complete the entry form on the KNA travel form URL or website, and all inbound passengers must still submit results of a negative RT-PCR test done within 72 hours of travel to the Federation. Ladies and gentlemen, if you don't remember anything else this afternoon, please, it's of paramount importance that you wear your face mask once you walk through your front door in the mornings, and you keep it on until you get back home at nights. Wearing your face mask is of paramount importance at this time. It's going to protect you from the virus that is circulating. Please always maintain good hand hygiene. You need to make sure you get a little bottle of hand sanitizer and walk with it. Make sure your hands are cleaned at all times, especially after touching those high-touch areas, doorknobs, counters, when you're going to the stores, when you're going to the banks, etc. And when you're going to the grocery stores and you're pushing the trolley with your groceries, make sure you sanitize immediately afterwards. Always maintain 6 feet distance away from others. Avoid crowds at this time. Please, we are asking you to adhere to measures. These measures are going to make the difference between those of us who are negative and those who would contract the disease. Protect yourself from the COVID-19 virus that's circulating. Do not wait, vaccinate. Thank you.
Thank you very much, Dr. Laws. I now invite Superintendent Cromwell Henry to present us with his report.
Thank you very much, Mr. Williams, and a pleasant good afternoon to all listening to this broadcast via whatever means. We have just heard the CN announce that we are in community spread, and so I would like you to take my presentation in that context, that we are in community spread, and you should treat everyone as possible positive case. But I would like to first begin by thanking those citizens, residents, so far for their cooperation during this period of restricted movement at night. We see persons making a concerted effort to get off the streets by 11 p.m. and bars are closing well before that 11 p.m. hour to allow their staff and other patrons to get home on time. The nightly restrictions of movement will remain in place until June 8th, unless extended. We urge your continued cooperation. Having said that, though, I must mention those persons who weren't as cooperative as we would have liked. There were a few establishments over the weekend whereby the police had to force close them long before the 10 p.m. recommended time, because these bars were in violation of the COVID-19 protocols, particularly the protocols with respect to social, physical distancing and sanitization. They were overcrowded, in other words, and so they were forced to close. The operators of these bars, they were issued with tickets. So these tickets carry a fine of $500, and they were issued these tickets for failing to observe or adhere to the protocols at the establishment. 6 persons were arrested, 4 on St. Kitts and 2 on Nevis, from the curfew. And additionally, 20 tickets were issued to persons for failing to wear their mask in public. Each ticket carry a fine of $100. We continue to seek the cooperation of the operators of and the users of public service vehicles. The current restriction on the number of passengers these vehicles can carry was to reduce the risk of transmission of the virus and to limit the number of persons exposed should there be a positive case on board. We also ask that the private mass transport vehicles such as churches and businesses to likewise reduce your load to half of your capacity. Again, this is a public health measure intended to control and prevent the spread of the virus, and it's only for a limited time until June 8th, of course, unless there's a need to extend it beyond that time. The CEO mentioned the international games that are scheduled for Warner Park on June 8th. I would just want to reiterate that these matches would be spectatorless. Only match officials and players would be permitted in the stadium. And so we ask the public to refrain going to the stadium and climbing on the wall or the Carnival City roof be permitted, and other security personnel will be on hand to prevent this. In closing, I want to again make an appeal to everyone to follow the pharmaceutical and pharmaceutical measures that are intended to control this virus. Thank you.
Thank you very much, Superintendent. I now invite the Honorable Akila Byron Nisbet, the Minister of Health, to make an address.
Thank you very much, Mr. Williams, and good afternoon to all who are viewing and listening to today's briefing. As we have heard from the CMO and the Medical Chief of Staff, we are currently following active cases of COVID-19 within our communities. We knew that this would, and we have been preparing for this to happen. So yes, we are following active cases within our communities, and we're asking persons to stay vigilant of the protocols. But as indicated, we have been preparing. And how have we been preparing? By providing with the necessary information pertaining to the virus since about March March of 2020, we have been here week after week providing you with information on the COVID-19 virus, and not only just getting us prepared, but getting you prepared in actuality. The doctors have been here speaking to you and telling you about the non-pharmaceutical measures, and they have been reiterated again. Social distancing, wearing your mask, hand sanitizer. I make sure I keep a hand sanitizer in my bag. In my vehicle, I always have my hand sanitizer. My masks are always closed so I can grab and go. And that's what we need people to begin to do. Again, we are appealing to you to follow the measures. The measures that we must adopt, and this is the measures that we must continue. When we spoke to you about these measures, we would have indicated that these are the measures that must be adopted until vaccines became available and we are able to build the herd immunity required for us to be able to get back to some level of normalcy. When vaccines were identified to be in final testing, the doctors again came here and educated the public on the various vaccines and the technologies that were used in each of the potential vaccines. When we confirmed the use and secured the Oxford AstraZeneca vaccines, we again came to you and spoke to you about the vaccine chosen and took it even further, where the Ministry of Health made available a number of our doctors, nurses, and health educators who have actively engaged in a number of more interactive sessions at various institutions, businesses, and anywhere persons requested these education sessions. At these education sessions, persons were able to ask questions and seek clarity in order to make an informed decision on whether they would take the vaccine. These interactive education sessions continue, and all you have to do to request to have someone come and speak with you is to call 31, and our team is readily available to assist. At this point, we are now at our 60% mark of us who are well on their way to being fully vaccinated. To those persons who would have made the decision and step forward and have been vaccinated, we say thank you. You are doing your part to help in our fight against COVID-19. It is also important at this point to thank our hard-working team at the Ministry of Health. We have all been working extremely hard to keep our country safe. Our nurses, our doctors, our contact tracers, giving their all to ensure we keep our country safe, doubling up efforts at times so balance their regular duties and our regular health services, while at the same time offering the vaccines, testing, and going through the contact tracing exercise. However, I want to assure the general public that our healthcare system is robust based on the investments that we have made in it, and it stands ready to combat any significant number of COVID-19 cases. We are hopeful that our system will not become overwhelmed, as we know the majority will to do the right thing and get vaccinated. At the Ministry of Health, we still have an adequate supply of ventilators, oxygen concentrators, PPEs, testing reagents, and testing kits for COVID-19. And so we've made sure that we prepared ourselves. I want the public to understand vaccines everywhere around the world right now is commodity. And to tell you that India, which is one of the largest manufacturers for the vaccines within our supplying to our region, is no longer exporting vaccine. It's just the reality at this time, as they themselves are dealing with their own crisis. However, I want to assure the public that the Ministry of Health continues to work behind the scenes to secure more vaccines. As you have heard, the current batch of vaccines we have would expire on June 30th. At this stage, based on the numbers, we do believe that we're able to use all of those vaccines by June 30th. But we are working assiduously to ensure that we are able to secure more vaccines and exploring every option possible. And we are confident that we would be able to receive more vaccines in short order. And so I just want to make the plea once again to everyone. Take advantage of the opportunity to become fully vaccinated. Again, the virus is in our communities. The way that we would stop the spread of the virus and the effect that it would have within our communities is by making sure that we are able to achieve herd immunity. We have a greater number of persons vaccinated. Those of you who are listening are pleading with you. The non-pharmaceutical measures are also still very important and relevant at this time. Please remember to wear your mask from you leave your house in the morning until you return to your house in the evening. Please remember to keep your hands clean. And sanitizers are very important at this time. Please remember to keep your social distance of at least 6 feet apart. And make sure that if you can, that you go out and become vaccinated. And that plea to you today. You've heard it from the doctors. The virus is in our communities. And so we are asking everyone to do their part, to make sure that you do your part. We've always said that it's an all of society approach. And so now we are asking you to do your part to protect your communities, your families, your friends, and your loved ones. Get vaccinated and make sure you continue to adhere to all the protocols that have been asked of you over the last year. So thank you once again. And again, we will continue in the Ministry of Health to do all that we can to keep you safe. And we want you in turn to do what you have to do to keep you and your community safe as well. Thank you.
Thank you, Minister Byron. I would now invite Mr. Abdia Samuel, the chair of the National COVID-19 Task Force and the National Disaster Coordinator at NEMA, to give us his presentation.
Thank you, Mr. Williams, and a pleasant good afternoon. Today marks the start of the 2021 hurricane season. In this regard, I am to the general public to begin their preparedness measures. It is predicted that we may have a 60% chance of experiencing a above average season. In this regard, you need to do the necessary to begin your personal preparations for your homes and your workplaces. Case in point, if you don't have a hurricane plan, know where your emergency shelters are. It's very important for you to know where to go in the event that your residence has been impacted. It is also important for you to know the emergency numbers for the first response agencies such as the fire department, the police force, defense force, and of course NEMA and St. Kitts and NDMD and NEVIS. It's important for you to also pay attention to the local competent authorities to provide you with information such as the local Met offices and also your local or your national disaster emergency management departments and agencies. This is the critical time for you to go through your checklist, your list of supplies. If you suffer from any type of illness, you need to have sufficient medication to take you for a period of at least 7 days. This is the time for your assessment of your properties, also your homes. Strengthen the weakened areas within your homes, and also do your best that your gutters, waterways are cleared, your drainage are, and also clip your trees. Not to cut them, but you should clip them. If you need to cut them, well, you will have to make that determination. Ladies and gentlemen, let us prepare. It is important for you to know that this, like you, we are going to go through a 3-hazard type of environment. Facing the upsurge in COVID-19 cases, as previously by the CMO and other presenters. We are facing average hurricane season with approximately 20 named storms that those 20 named storms, 3 to 5 may turn out to be major, meaning category to 5. Just imagine being impacted by a hurricane in the environment, in this environment of COVID-19, and also we are facing serious drought challenge. The CIMH in Barbados has made all the national stars within the CARICOM region that a number of these are facing the drought situation. I am appealing to the general public to apply the necessary water conservation measures in order for us to go through this period of severe drought. Today, the COVID-19 task force would have had its weekly meeting, and we were notified by the authority that the Celebrity Millennium with 800 passengers was scheduled to arrive in St. Kitts or make a port of call in St. Kitts on the 8th of June. Let me just reassure you that all 800 passengers on these vessels are vaccinated passengers. Again, let me repeat, all 800 passengers are fully vaccinated. 2%, which would have been children under the age of 12, would not have been vaccinated. However, 98% of the passengers on board this vessel would have been vaccinated. Ladies and gentlemen, and in particular those who are in the tourism industry, you need to go get vaccinated. It's rather unfortunate that we are saying that there are no economy challenges when it comes to the job market. However, a large percentage of persons in the industry are not vaccinated. We are making an appeal to help us to bring back our economy, to make St. Kitts and Nevis a niche market for these particular tourism products. So we help us in this regard. Vaccinate. It's not fair that these passengers who are paying their money to come to St. Kitts and Nevis and be a part of our tourism destination and product, that they are coming vaccinated, but we want to provide a service to them without being vaccinated. If we can give them the reassurance that as service providers, we are vaccinated to protect them, and while protecting us, certain we are going to do business. However, I must report to you though that this particular port of call has been delayed 19th of June. Again, I am appeal to do your best, go now, get vaccinated so that we can this critical in our effort to bring back our, also make our tourism product more competitive in a competitive market. So all of you in the tourism product, all of you who would like to provide the service to these 800 passengers that will be coming to our shores in the next few weeks, once we are able, to support the minister in curbing this particular upsurge, please go and get vaccinated. I feel good. I have already gotten my second dose, and I was able to join the chorus and the task that I am fully vaccinated. Over the past weeks, we have had to provide some social support to 114 households. 114 households. I am happy to continue to provide this support to these individuals. However, we are making an individual to stay at home. Again, if you have been placed in home quarantine, please stay at home. However, I want to commend the general vigilance in sharing information. I don't know how to get it, but we are getting some crucial and critical information. Unanimous scholars of persons supposed to be in quarantine are breaking quarantine. Please do your best for this effort. Your part, we are going to get this surge in cases, or this curve. We're going to get this curve subdued and controlled. I've been getting a lot of calls regarding the entry status, since the Prime Minister would have announced that person would have need to be vaccinated in order to enter St. Kitts and Nevis. In my discussion with the Attorney General and my Permanent Secretary, Mr. Osman Petty, let me just bring some clarity. Nationals, citizens, residents will be allowed to. That doesn't mean we don't encourage you to go and get vaccinated. And also students who hold this residency status, again, students who hold residency status, they will be able to enter the Federation. Again, let me repeat, getting this question over and over. Nationals, citizens, residents, students with residency status will be permitted to enter the Federation of St. Kitts and Nevis as it regards to the vaccination to enter here. So again, I want to appeal to everyone to use the opportunity and get vaccinated, begin to prepare for the hurricane season. When it comes to sheltering, we actually apply a part of the body system where we appeal to neighbors to take in their neighbors who are more in terms of their structure. Very much service and the feedback I am getting. No one would want to take you in. Persons will have a bit of concern, take you in if you're not vaccinated. Do your best. Go get vaccinated before we reach the peak of the hurricane season, that if your household affected, your neighbor can help you and take you in because they feel it. So protect your neighbor, protect yourself, protect all of us. Go, do your best and get vaccinated. Let us continue to pray so that the good Lord can divert any hurricane that might be coming our way. Thank you, Mr. Williams.
Thank you very much, Mr. Samuel. That brings us to the question and answer segment of our press briefing for today. The first questions are from Win. I'll ask them in succession because they're all somehow related. When is the next vaccine arrive in St. Kitts and Nevis? What are the vaccines that are due to expire in a matter of weeks? Are you required to be vaccinated to use SCASPA's facilities effective today?
Thank you very much, Mr. Williams. Of when we expect to receive next batch of vaccines, currently in word on the date for the next batch, but we are hopeful that as soon as we get it on the exact, we will come back and provide that information. Thank you.
As to vaccine and expiration date, we have seen a significant uptake in the coming forward to be vaccinated. We have vaccines in storage for persons who are due their second shot, and we hope that we would use all the vaccines. You've heard before that we have almost 60% of persons who received their first shot and 22.7% who have received a second shot. We'll continue with the positive outlook that we have and continue to vaccinate until we use every single dose.
Okay. The next question. Someone who has had a recent blood transfusion and plasma transfusion, can they take vaccine, or would they have to wait a certain number of months before they can do so? That, for instance, it is advisable to hold off on taking the MMR, mumps, measles, and rubella vaccine until 3 to 11 months after blood transfusion.
One can be vaccinated against COVID-19 even if had a blood transfusion. There is no direct contraindication.
This question is from Von Radio. It was confirmed on Sunday that the recoveries, leaving 21 active cases at the time. Were these 3 persons quarantined for the full 14 days as the task force notified the public COVID-19 about this cluster, which started with 46? Could you explain?
A very good question, Mr. Williams. So today we announced that we have 73 confirmed cases. St. Kitts and Nevis, today we have 48 recoveries and 25 cases. Our 3 most recent recoveries, they were identified as cases 1 in quarantine. So they landed in the Federation, they went right into quarantine, and then they were identified and was diagnosed as positive for COVID while in quarantine. Once they were diagnosed, they were placed in isolation, they were monitored, and then they got two successive negative tests, and then they were deemed recovered. Thank you.
Thank you, Dr. Laws. This question, but it was, can fully vaccinated persons attend the football game? And if there is a large percentage of persons negative from the assessment of the COVID-19, can this help the decision to reopen schools on Monday?
I have indicated that the regulation, the playing of for persons attending these matches. However, an exception for the players and the officials is approved, and so only players and officials will be permitted in the stadium. No spectators, whether or not you are vaccinated, will be permitted.
And so that second question, so we have students in 6 schools that are being monitored. They are in self-quarantine. They are contacts of cases. They are in self-quarantine. They're being monitored. And then later this week, we will be doing them. The results of the tests will determine the way forward in terms of the reopening of schools. And so, yes, if all the tests return negative, and if we do not have any other schools implicated through our contact tracing process, there is a likelihood that schools will reopen.
Is from Von. It is said that the number of persons seen on the streets since placed in quarantine. What task force doing to make sure that this does not happen?
I think I would have indicated earlier that events to any or disregard any instruction directions given by the chief medical officer with respect. So whenever a person is placed in quarantine by this chief medical officer, that person is bound by law to remain in quarantine. We have the compliance team who is actively engaged in ensuring that these persons remain in quarantine. Additionally, the district officers are aware, or whenever this violation is brought to our attention, the district police is made aware, and we will take the necessary actions. We are those persons to take this quarantine serious, and whenever you're told to stay at home, just stay at home. You do not know yourself, and moving about could expose other persons should you become positive. So just comply with the directions and stay at home until you're given the clear to move about. Thank you.
This is our last question for the day. And it's a question for Superintendent Henry. Someone is making a case that the Spanish Bars and Pond Road last Sunday had parties. And what did the police do about it?
Well, did mention that several bars were closed down. Those were the bars that were closed down. And Saturday and Sunday, they were closed down well before the recommended closing time. This would be ticket for the violation of these premises. And these tickets carry a fine of $500 each.
I did mention it was the last one, but I do have a last one. And it is, I had my second vaccination on the 14th of May and have not been able to get my card stating so. What is the reason for this? We are being told when they are ready. I know many people who did theirs with no problem. I just want a reasonable explanation. Dr. Lords.
Williams, the is simple. Thousands of cards are waiting signal by the DCHS, so the cards are being signed. Or I can assure the public all cards will be ready by week. So the cards can be collected as at the 9th of June. So all cards will be ready within 1 week. All cards can be collected by the 9th of June.
Thank you very much, Dr. Laws. That brings us to the end of our question and answer segment for today and the end of our briefing for today. I want to thank the Honorable Akila Byron Nisbet for her, Dr. Camkinson, Chief of Staff, Dr. Hazel Laws, our Chief Medical Officer, Superintendent Cromwell Henry, Mr. Abdias Samuel, the Chair of the National COVID-19 Task Force and National Disaster Coordinator. Equally thank the Chair of Disaster Mitigation Council, who is here, and the co-chair of the Disaster Mitigation Council, the Honorable Wendy Phipps. The chair is our Attorney General, the Honorable Vincent Byron. I thank Mrs. Christmas for her service of message, and I thank the entire communication team here at the National Emergency Operations Center. Additionally, I thank ZIZ and all media houses who continue to partner with us in this fight against the COVID-19 pandemic. Additionally, I will be remiss if I did not mention the Permanent Secretary in the Ministry of Health, Dr. Dolores Stapleton Harris. Thank you very much to all of you, and we will be for another COVID-19 press briefing. As you realize, it's a very fluid situation that we're in. So sometimes I can't even say next Wednesday. It could tomorrow, Friday, we can hear. But whatever the case and whatever it takes, we will be here to keep you informed in terms of what's happening, because it is important to you and it is important to us. Take care next time. I am Les Roy Williams.